Good morning. I'm back, and Jim is actually gone for the day, but I would like to talk to Dr. Everett Beyer. So he's here with us today. And Everett, I want to talk to you about something that Jim wouldn't be able to.
Okay.
Female hormones. Now, I know that hormones are, or women are very affected by their hormones, probably more than men. And it starts right when we begin our periods, and it lasts for decades, 40 years, 50 years sometimes.
Right.
And the hormones really affect us. And I know for myself, it was a big struggle when I transitioned into menopause. A lot of other things were happening in my life. And then on top of that, all these hormone things were going on. Now, I know that many of the people who watch this and who are in Mastering Alchemy are 40-ish, so they're soon to be transitioning into that place. So I thought, what the heck, I have you here this morning. What's your hit on, since you're a natural functional medicine doctor, what's your hit on hormones in women?
Okay. Certainly very important. We want to keep them balanced. And when we're talking about hormones, we're talking about the thyroid hormones and other hormones also, besides just our testosterone, estrogen, progesterone, etc. And as you know, everything's connected. And certainly in this day and age, we're affected and influenced by our environment. In fact, the problem with everyone, particularly as the age, Roxane, as you're certainly aware of, is the degenerative changes that starts to happen, and our chronic diseases start to increase in our system and in our body. Well, those are all affected and driven by the hormones, either directly or indirectly. And what needs to be done is to balance those hormones out. One thing that upsets the hormones is the fact that we are in such a toxic environment. And a lot of times people don't realize and understand the effect of the toxicities of the food that they're eating, the air that they're breathing, of things they come in contact with on a daily basis. That upsets the functioning of our hormones, besides the food that we eat. And as I mentioned before and talked about it with Jim, food is more than vitamins, minerals, nutrients, carbohydrates, protein, and fat. It's actually information. And it's information to our cells, and it's information to our hormones. So what we want to do is get those things working in a synergistic effect where they're balanced. And one way to do that, and this is very important for all the different types of hormonal situations, PCOS, endometriosis, all these types of things is where hormones are out of balance. So we want to bring things back into harmony and balance. So the best way, the first place to start is with a professional metabolic detox that is going to start to get rid of the debris that's collected, let you send the right signals with the food that you're eating to the genes, your organ cells, tissues, and the hormones. That's very balancing to the hormones. For instance, as women start to go through menopause, if they would do a metabolic detox, that will start clearing up all those symptoms that they're having and not wanting, and can start to balance things back out so they can get things leveled out. And what will tend to happen is they're starting to lose their normal hormone levels because they're going through menopause, and they start looking for additional hormones, let's say from a medical standpoint. And that's certainly necessary in some situations. But first, you want to get a ground level and see where you're at.
So you mean get a blood test type of thing? Yeah.
Yes, and one way of doing that is to do a metabolic detox, because that gets the poisons and debris out that can be affecting the hormones so they can't function at an optimal level, and particularly if people are lacking the vitamins, minerals, and nutrients that is needed to just produce the hormones. For instance, watch this. This is just so incredible. As we get older, our cholesterol levels start going up.
Right.
Well, why does that happen? They weren't up before. Well, cholesterol is very important in our system, and we need it, and our body needs it. It's incorporated into our cell membranes, but also, guess what it does? It makes our hormones. Okay, so hormones are going low. The body says, hey, we got to kick it up here so we can help them out, and they start making a little more cholesterol. Well, we don't want to push that down too far because that can be a problem, but we do want things balanced out. And just in passing quickly, not to digress, cholesterol is not the cause of heart disease. Okay, it is just can contribute to it with other factors there. But having an optimal level of your functioning of the organ cells and tissues, what detox does, it pulls the poisonous toxins out, lets things balance out. Then you want to take a look and see where your hormone levels are. Not with them all, with your body and system all toxified, where everything is cattywampus and not signaling and giving the right information anyway.
Now, some women want to go the totally natural way. There's creams, there's supplements, and then there's others that do bioidentical hormones.
Absolutely.
And then there's others on the extreme where they take chemical hormones.
Synthetic.
Synthetic. So I'm kind of in the middle. I've because it was so severe for me, the natural didn't kick in, and that was before I knew anything about metabolic cleanses.
Sure.
The natural didn't quite work, so I went into the bioidentical hormones. But now I'm interested, now that I'm cleaner and when I went through menopause, there was no information for people, and doctors really didn't know. There was only that book written by that actress, Susan something with the blonde hair. That was really the only thing available. But now, Summers, yeah. Susan Summers. But now there's so much information out there that a woman going into this phase of her life has more options, and perhaps a more natural way of addressing it would be more effective.
Absolutely, and it is going to help things balance more readily and easier. For instance, if someone is chronically anemic, that affects their whole system and how they feel and the hormones. If their thyroid is not functioning at optimal level, and this is a big problem, we'll see a lot of thyroid patients, particularly a lot of females, and they're on thyroid hormone. There's no problem with that. If they don't have enough, they need it. But why is it now low and it wasn't before?
Right.
That's the question. And we've been just treating symptoms in our healthcare system in the 3D mass consciousness of the healthcare arena. And now we're moving into something different. And we're moving into actually getting to the root cause, treating the cause, getting results without the side effects that is going to bring us into that optimal level of health that we want. So, for instance, just with thyroid, we'll see females that they take their thyroid medication. For a third of them, they're going to be okay, and they just keep taking it, no problem. For another third, they're going to take it. It lasts for about 3 months or so, and all the symptoms start coming back. They're looking for help. They go back, they raise it, change it to different thyroid medications, still the same thing. And we'll see them. There will be those that they start taking the thyroid hormone to begin with, and they're pulling their hair out by the time they get to see you because they have no results.
Yeah.
And one thing, 80%, according to Mayo Clinic, 80% of the females that have the low thyroid have a situation where they have antibodies against the thyroid. Now, this is an autoimmune disease called Hashimoto's. Well, you need to, and what's causing that is an unhappy immune system. We need to make the immune system happy. Even though you're taking the thyroid hormone and you have enough hormone in your bloodstream, they're still having the same problems about if their hair is not falling out, they're pulling it out.
Right.
And so they'll come in, and we make the immune system happy. For instance, it's an autoimmune disease, and the likelihood of having another autoimmune disease at the same time can be as high as 80% without you knowing it, and it's going on. So we need to balance that immune system out because that's the real cause. Well, what's making it unhappy? Watch this. 80% of the immune system is, guess where? Intestinal tract. The microbiome. That's why we start with a detox, balance that out, get things balanced out, and things start changing.
So a woman...
You might call it magic, but it's not.
It's all in your gut.
Yeah.
So a woman nowadays, a woman who's about to go into this phase of her life has a lot more information, a lot more
Yes.
resources. And what I'm hearing from you is first clear out the system,
Yes.
get to a 0 point,
Exactly.
and then get a blood test, maybe saliva tests, other tests as well, to see really when you're not toxic, where your levels are, and then to talk to someone like you about what are my options, the natural, the creams, the bioidentical, which is way different than it used to be.
Yes, exactly right. And along with that, we're going to with the as a functional medicine physician and the natural approach that, and this is the new focus of the healthcare arena, and it's stepping outside. It's actually stepping outside of the arena that we've had in the past, and the Cleveland Clinic is cutting edge of it. They now have a functional med department.
Oh, very good.
Yes, cutting edge, because the bottom line is people want results, and it brings results because it
Yeah.
treats the cause instead of manage symptoms. And so by looking at the real cause, and we're talking about stopping, reversing Alzheimer's.
Yeah, reversing aging.
Yes, aging itself is
Yeah.
exactly right. So we're finding the right buttons to hit, we're bringing that information about, and it's not that hard to do. It's
Well,
just making the right choices, and people don't know the choices to make.
Well, and talking to you about it, and your enthusiasm, it makes logical sense.
Oh, very.
It just makes sense to do it this way versus go to the traditional allopathics and take a pill.
Yes, yes. Everything's connected.
Yeah.
And that's why with hormones, if the GI tract's not happy, it ain't going to be happy, because watch, the reason that they're having the autoimmune disease to begin with for the thyroid, they're having leaky gut. The intestinal tract has leaks in it where food particles are coming across. Your immune system looks at those, say, foreign invaders. They make antibodies. Those antibodies then cross-react with your own tissues, and autoimmune disease attacks the thyroid. The real problem is the immune system's confused and unhappy. So you've got to balance that out and start in that
Yeah,
GI tract.
makes sense.
Yeah.
You have a lot of information, and what I would like to do is just point people to your website that's here on this post. And great conversation. Thank you.
Oh, my pleasure.